पीछे पीछे, हाँ नीचे वाले नीचे वाले।
ऑन है, स्ट्रीमिंग शुरू हो गया। कितने स्टूडेंट्स हैं बताओ पहले, कोई आए तभी शुरू करो, नहीं तो फिर मुझे भी दे दो लिंक, मैं भी खोल लूँ।
मिस कॉल मेरे फ़ोन पे मिस कॉल कर दूँगा आपको। 9958126055।
कट रहा है, आपको कॉल नहीं जा रहा। 99561260।
9958।
अच्छा, नाम बताइए।
मनमोहन सिंह। बच्चे हैं।
अच्छा ठीक है, मैं शुरू कर दूँ। ठीक है। हाँ जी, गुड मॉर्निंग टू डियर स्टूडेंट्स, and so we shall be talking about breastfeeding and lactation problems. Now since I'll be talking and you will not be able to speak out to me, so I would request you to put down your questions, comments in the chat box, and then we can take them at the end of the session. So why breastfeeding? And you would think that it is just a repetition of what we did in 6th semester. So there is some difference to it. So what we are going to cover today is, why is nutrition of healthy newborns important? So why is it that we are talking about nutrition every now and then? So if we understand that yes, nutrition is important, what is the best option? And the answer to the second question, you know, even before the beginning of this class. So that is breastfeeding. And the next thing is that how do I ensure optimum breastfeeding? Now, having understood that breastfeeding is the best, I need to ensure how do I go ahead and ensure that my mother-infant diet has optimum breastfeeding. We shall understand the problems and solutions, and finally we have questions for you, for which I'll give you a minute, put down your answers, and then we can discuss the potential answers which should be told to the mother-infant diet. So if you look at this figure, and herein I would like to show you that on the y-axis are the possible interventions which, if we talk about universal coverage, so if you see, the breastfeeding is there, insecticide treating materials are there, complementary feeding is there, zinc is there, influenza B vaccine is there, delivery, vitamin A, and so on. And if you see, the single most important and the single most efficacious intervention which can actually decrease under 5 deaths with its universal coverage is breastfeeding, breastfeeding, and breastfeeding. So what is breastfeeding? Breastfeeding is exclusive breastfeeding for the first 6 months and continued breastfeeding thereafter. People continue it for 2 years or even longer. So breastfeeding is the single most important intervention which is responsible for the maximum decrease in the proportion of under 5 child death. So that is the take home first message, that is breastfeeding is the single most important intervention listed to prevent under 5 deaths. Having said that, let us now understand why am I talking about nutrition of healthy newborn infant. So baby is growing the maximum in the first year, so much so that suppose a baby's birth weight was 2.5 kgs, the baby would actually double the birth weight by about first 4 months and triple the birth weight. So a 2.5 kg infant would roughly be 7.58 kgs by the end of 12 months. Not only weight, the brain growth is maximum in the first 6 months of age, and that is why nutrition is so very important. Nonetheless, nutrition also establishes the gut microbiome of the baby, which has immediate and lifelong effects. In addition to that, nutrition should be such that it matches with the gut immaturity. A newborn infant's gut is not exposed to the other organisms because the baby is directly out from the mother's womb. And last but not the least, nutrition should also have some non-nutritive benefits. So brain growth is going on, baby is doubling the birth weight, I need something which should match the high demand with the gut immaturity. In addition to that, something which has non-nutritive benefits, and the answer is breast milk. It is calorie dense, so roughly 67 kilocalories per deciliter. Protein 1 gram per deciliter. It is rich in fat. It promotes my brain growth. So this is the calorie intake. My contention in the previous slide was that even brain growth is maximum in the first 6 months. So this promotes brain growth because lactose content is very high. It is about 7 grams per deciliter. Nucleotides are there. In addition to that, the fat globules ensure that you have a good systemic absorption of phospholipids. So phospholipids, nucleotides and lactose are required for optimal brain growth. Having said that, not only nutrition, the weight gain, and not only brain growth, it is also good for the health of the gut. So oligosaccharides are the third important component of human milk after the listed ones before. Prebiotics in the human milk promote the growth of lactobacilli and bifidobacterium. So that is the reason that this is important to be present and to consume something which is there only in breast milk. The gut is immature. The breast milk is whey dominant. The whey casein ratio is 80:20 and this is easily digestible. On the other hand, cow's milk is 20:80 and hence is not easily digestible. The tip of the villi has high lactase and the carbohydrate is easily absorbed. Fatty acid absorption is promoted by bile salt lipase, which is important. So we understood that there are some nutritive components, a proper ratio of whey and casein, a higher rich source of phospholipids, and there are oligosaccharides. Coming to the non-nutritive benefits of breastfeeding. Now here are some figures which, if remembered, are good. If not remembered, at least gross numbers should be known at your level. And the first figure that I say is the number 15 and 5. So this decreases all-cause mortality. When I say all-cause mortality, I mean diarrhea, respiratory infections, hospitalization, any other infection. So all-cause mortality, imagine the impact. So 15 times among infants who are exclusively breastfed. Even after that, the mortality is decreased by 2 times. So all-cause mortality 15 times and 2 times, infection-related mortality 8 times and 2 times in the respective age groups. Hospitalizations are decreased, diarrheal episodes are halved, and respiratory infections are 1/3. Now how do I remember these numbers? So all-cause mortality 15 and 2, infection-related mortality 8 and 2, diarrhea by half, and respiratory infections by 1/3. So these are some short-term and medium-term non-nutritive benefits of breastfeeding. Nonetheless, there are some long-term benefits as well. And that is, it reduces allergic rhinitis, it reduces asthma, it reduces malocclusion up till the age of 2 years. Beyond that, there is a slight increase in the incidence. It decreases the risk of overweight, decreases the risk of obesity and type 2 diabetes. Not only that, there is an increase in intelligence quotient by almost 2 points, and hence there would be greater income in life. So these are the long-term benefits, non-nutritive benefits of breastfeeding. So if I would repeat, all-cause mortality 15/2, infection-related mortality 18 and 2, diarrhea half, respiratory infections 1/3, rhinitis, asthma, malocclusion less, and IQ decreased by 2. So this is the magic number of 2. It's coming 2 times in all-cause mortality, 2 times infection-related mortality, about half in diarrhea, and almost a 2-point increase in IQ. So you can roughly remember the magic figure 2. So again, reiterating, the most important take-home message from this slide is, it is the most cost-effective intervention with lifelong benefits. So the obstetrics department people, faculty would also tell you, it decreases the risk of breast cancer, ovarian cancer, mother's postpartum hemorrhage, increased oxytocin, so the uterus contracts, and there is decreased risk of psychosis. In addition to that, it leads to economic savings, decreased expenditure on formula milk, and it is sad that one formula milk can, if it has to be made and marketed, it actually consumes 4,000 ml of water. So 4 liters of water is consumed in making 1 dabba of formula milk, and imagine the problems that you're causing for environment is the tin can, the formula feed, consumption of water, and lot of wastage. So in addition to whatever benefits for the baby, the benefits for the mother and economic savings and nature, not putting things which are cannot be decomposed, is also another loss which can happen if you do not give breast milk. So having understood that yes, breast milk has nutritive advantages and has non-nutritive advantages, let us try and understand how to optimize breastfeeding. So the first important point is, motivate the mother, motivate the family, and this motivation actually has to start well before the mother comes in and delivers to you. So prenatal education, motivation of the mother, motivation of the family. Promote the presence of a birth companion. This is a new concept promoted by the Government of India, that all mothers coming for delivery should have a lady, a relative standing by the side of the mother while she is delivering. Do not suction the mouth routinely. The moment you deliver the baby with the cord intact, just place the baby over the mother's abdomen. Ensure a prolonged skin to skin contact. In the same time, you would actually see the baby doing breast crawl. I will come to a picture showing breast crawl. Clamp the cord after 1 minute, but do not separate the mother. I will stress on the word do not. Do not separate the mother and the baby. Let them remain together as a dyad, and baby will have a spontaneous breast call and will start breastfeeding immediately after birth. Support the mother-baby dyad, promote frequent breastfeeding, tell the mother that night feeds are equally important. Herein comes the role of the healthcare professional to promote breastfeeding reflexes. We will come to the details in the subsequent slides. So currently the practice should be bedding in. Initially you would have heard us speaking rooming in, rooming in. Mother and baby should be kept together. So room in, room them in. The concept actually is bedding in. There should be no separate cot in the room, no pacifiers, no prelactal feeds like ghutti or honey or whatever ritual customs. It is only breastfeeding, and the mother-baby dyad have to be nursed in the same bed. Yes, so these are some steps which can help you to achieve optimized breastfeeding. Having done all these steps, ensure that the baby is positioned well and the baby is attached well. So when I say position, I mean how is the baby held? How is the baby positioned? When I say latch, I mean attachment. What is the anatomical relationship of the baby's mouth depicted by this hand and the mother's breast, which is to be taken up by the baby. So this is latch, and holding the baby is positioning. Do not forget that this does not end here. So just counseling and then leaving the mother-baby dyad, no, that will not work. Assess the lactation prior to hospital discharge. Okay. Then promote cue-based feeding. And this is cue-based means that the baby would actually turn the mouth, baby would open, baby would do rooting, go towards the nipple. So try to find out the mother. So the moment the milk let down, that means mother actually gets a perception that she's having lot of milk. Promote cue-based feeding, and feeding has to be encouraged at least 3 hourly. Best would be 2 to 3 hourly. That is the range that we give. Ensure that mother feeds on one side, complete breast emptying is ensured, and in the next session you can actually go on to the other breast. So do not tell the mother yahan se pila lijiye phir uske baad yahan se pila lijiye. That is not to be done. Encourage that complete breast emptying happens before switching the breast for the next feed. So the take home is, the first take home was that breastfeeding is the single most important method or intervention which can reduce under 5 deaths. The second thing is that one should optimize and promote exclusive breastfeeding for 6 months and continued breastfeeding for 2 years or beyond. So that is the second take home. The third take home till now is that breast milk feeding has both nutritive and non-nutritive benefits, and we listed the magic figure 2 where we talked about the non-nutritive benefits of breastfeeding. So we understood that yes, nutrition is important, and the only sole mode of ensuring optimal nutrition is breastfeeding. Having said that, now this is a classical figure of a baby. If you see here, the cord is just tied. The baby is on the mother's breast. The baby is holding on to the mother's nipple. This is the mother's hand. This is the mother's hand. Baby is trying to crawl towards the mother nipple, and mind it, this is immediately after birth. So this is the spontaneous crawl of the baby towards the mother's breast in an attempt that I would actually latch on and take breastfeeding. So look at the way. This is what is something which is natural. So what nature never said ki after birth separate the mother and the baby, take the baby to the radiant warmer, warm the baby there. Damn it, nature never said that. They were born to be together. However, if the baby is unstable, no problem, take the baby. Baby is not breathing, take the baby. But all babies who are crying at birth, who are otherwise okay, there are no other issues, their baby should be kept on the mother's breast, on the mother's abdomen, dried there, and all effort should be made to ensure the first breastfeeding. Okay, so then I mentioned that optimal breastfeeding is ensured by optimal positioning. So what do I mean by optimal positioning? I would have loved to have you all in person and teach you with a mannequin, but short of that, if you see the mother in the yellow sari, so this mother is, what is she doing? The head, if you can look here, is in line with the body. Fine. So head is in line with the body. Mother is supporting the entire body with her forearm of the left side. So head in line with the body, whole body well supported. The third is baby is turned towards the mother, and fourth is baby is touching, the baby's abdomen is touching the mother's abdomen, and the unspelt or the unsaid word is eye contact between the mother and the baby. So head in line with the body, whole body well supported, baby turned towards the mother, baby's abdomen touching the mother's abdomen, and lastly is eye contact. You are not expected and requested not to say this, but while on rounds, while managing mother newborn diets, this is something which is important. So 4 points for ensuring optimal breastfeeding position for breastfeeding. Now herein I would pause for a minute and may I request you to tell me that out of these 4 points, which one is not observed in the mother and the baby, the mother wearing the blue sari. So I'm going to pause for 30 seconds and I'm going to wait for response from you. For all those who are awake, those who are sleeping can continue to sleep. But then what is there which tells me that this is not optimal positioning? So I'm going to wait for 30 seconds and I'm going to check your comments in the YouTube chat. So I'm going to ask you, for those who joined late, that yes, please see breastfeeding positioning and try and tell me what is not there in the second picture. Okay, so the Ayushi tells me that the picture is not visible. Okay, so Ayushi, the second picture, if how do I manage that? Can you see it now? Is it better? Okay, so Ujjwal and Ayushi cannot see the picture. Is it better now? I think you can see it now. So the first baby is actually the mother with yellow sari. Yes, Ujjwal says yes, it is visible. So this is the mother with the yellow sari. So head is in line with the body, whole body is well supported, and baby is turned towards the mother and baby's abdomen is turned towards the mother abdomen. So Manoj, Ayushi and Ujjwal, I want to learn from you three what is not there in good position in this baby, the second mother in blue sari. Manoj, wonderful. So the Manoj says, ma'am, it is whole body is not supported. Point well taken. Anything else? So head is in line with the body. Yes, it is. Whole body supported. No, it is not. Is the baby turned towards the mother? Manoj, Amisha, Ayushi and Ujjwal. Is the baby turned towards the mother? Yes or no? No, so that is another point. So baby is not turned towards the mother, and Ujjwal, Amisha, Ayushi and Manoj, in addition to that, baby's abdomen is not touching the mother's abdomen. So in case this is the issue, this baby is not optimally positioned. Fine? Yes, so I'm going to make it full screen now again, and we are going to go to the next slide, right? So let us see here, and so here if we see, now let us see this baby. So when I say attachment, I actually mean if this is the baby's mouth and this is the mother's breast, so this is optimal attachment. So what is optimal attachment? I would go in the following order. So the first thing is that the mouth is wide open. So here if you look at picture A, the mouth is wide open. So if you look at picture B, the mouth seems closed. Again, look at picture A. Areola is hardly visible, and whatever areola is visible is more above than below. Herein, the entire areola is outside the baby's mouth. So, mouth wide open, majority of the areola inside the baby's mouth. If at all areola is available, see my thumb is actually reaching the entire covering of the areola. So little areola I can see here, assuming that this is the mother's breast. So majority of the areola is inside the baby's mouth. If visible, something is visible above than below. Yes? So wide open mouth, majority of the areola inside the baby's mouth, slight margin is visible above. Chin is touching the mother's breast and lower lip is turned outward. So look at my thumb. So this is outwards. You cannot put it like this. So again, chin is touching the mother's breast. The mouth is wide open. More areola is visible above than below, and the lower lip is turned outward. The unsaid word is that the mother should not have any pain. But this is not to be told. So the last slide, the gray icon, and here the gray words are not to be told. This is only for you to understand, only for you to learn that yes, there is no pain while the baby is well attached. If the mother starts howling, dard ho raha hai, mujhe bahut dard ho raha hai, it is not optimal attachment. But this has not to be spoken. Again I say, mouth wide open, majority of the areola is inside the baby's mouth. More areola is visible above than below. The lower lip is turned outwards and chin is touching the mother's breast. So here, mouth wide open. Majority of the areola is inside the baby's mouth. Lower lip is everted. Don't worry, you may not be able to appreciate it anatomically. I'll show you a picture in a short while. And then you have the lower lip which is turned outwards. So good attachment, improper attachment, good attachment. Don't worry about figure D if you're not able to see it. No worries. So this is something which is important. So need not remember the details, but what is important is that mother has to place her fingers well behind the areola and not on the areola. So don't hold it close to the nipple. It has to be beyond the areola with the fingers forming a good support, right? And never tell her to hold it in a scissoring fashion. It should always be in a C fashion. So the mother actually holds the breast in a C fashion and never like this. So scissoring actually ends up breaking the fingers on the areola and is not recommended. Okay, so let us look at this. So this is just about acceptable. थोड़ा सा एरियोला ऊपर से दिख रहा है, लोअर लिप मुझे नहीं पता चल रहा है, बेबी का माउथ वाइड ओपन लग रहा है, तो just about acceptable. But if the baby actually is snugly going on to the mother, this is best attachment. Yes. So having said that, let me actually come to two major reflexes. The first is prolactin reflex. So this prolactin reflex actually is secreted in the blood after the feed. So mother has actively fed. Fine, the breastfeeding session is over. The prolactin surge would actually come in after this feed, and it will actually help the mother to produce ample amount of next feed. So what is important? So if the baby sucks, and this impulse will go to the anterior pituitary and prolactin will come. Sensory impulse from the nipple promotes prolactin production. So obviously sucking would promote, expression would promote, emptying would promote, and nighttime feeds would promote. Logical. So sucking or the baby sucking on the nipple is the single most important stimulus for production and for secretion of milk in the mother. Yes. So if the baby is not sucking, baby is inside the NICU, mother is not feeling like expressing milk, mother does not ensure complete emptying, mother sleeps off during the night. So incorrect position, mother in pain, prelacteal feeds, janam ghutti, shahad, honey, gripe water, they would just tell the baby to sleep off. Baby will be happy with the sugary things that he's been given. Baby will not suck onto the breast. So prolactin in the blood is secreted only once the baby has a good suckling effect on the nipple and the mother is not in pain. So if the mother says, I'm feeling pain, I'm having heavy bleeding, give her solace, start her on some analgesics, avoid prelacteal feeds, avoid top feeding, just reassure her. Even if you are in pain, just try and put the baby to the breast, you would have relief in pain. Give her some analgesics, but do not start top feeding. Once you start top feeding, you break this cycle. If you break this cycle, it might take another 24 hours for this stimulus to establish itself. Reason being, top feeding and prelacteal feeding would tell the baby, ब्रेस्ट मिल्क का क्या करना है, मुझे क्यों ब्रेस्ट फीड करना है, मेरे को तो मिल रहा है ऊपर से मिल्क. सो अवॉइड प्रीलैक्टल फीडिंग, top feeding and nighttime feeding have to be promoted. Now after prolactin, the second reflex is oxytocin. So if the baby sucks, the stimulus goes to the posterior pituitary and oxytocin is released. Oxytocin, unlike prolactin, does not happen after the breastfeed, it is during. So anything which is related to the baby, mother thinking of the baby with love. So even if you put a photograph in front of the mother and tell her to express milk, the milk output would be better. So for that particular breastfeeding, the sound of the baby crying heavily. Mother should not cry when the baby is crying. If the baby is crying, the sound of the baby is stimulating your breastfeeding. The sight of the baby, position the baby in front of you when you have to express if required, and the mother is relaxed, comfortable and confident. So worry, stress, pain, doubt, and that is what I generally tell my students when they come for bedsides. Just tell the mother, allay her anxiety, tell her everything will go well. Worry, stress, pain, doubt, WSPD are the 4 mnemonics that you have to remember, and that would decrease oxytocin reflex. So thinking lovingly of the baby, sound of the baby, sight of the baby, mother feeling relaxed is something which stimulates oxytocin production. So having understood 2 reflexes, which is prolactin reflex and oxytocin reflex, let us try and now understand the third definition, which is important for you. So this is something which you have to remember ad verbatim. So you will be asked, how do you ascertain adequacy of breastfeeding? So after baby is feeding, you hear that there is some audible swallowing. You hear that there is some, baby is having some audible swallowing. Baby is awake, alert and calm in between the breastfeeding sessions. So these are more like subjective statements. So one thing which is objective is baby is gaining adequate weight after having regaining the birth weight, and baby has 6 to 8 wet diapers. So for the first 2 bullet points, the statement which I would like to state is the following. Baby who is feeding continuously with slight intermittent pauses for good 10 to 15 minutes, and after that breastfeeding session the baby actually stays calm, awake but alert, or may might even go off to sleep only to get up spontaneously for the next feeding. So if these 2 bullet points were to be fused, this is the statement that we would like to hear from you people. So baby who is actively nursing for first 10 to 15 minutes, leaves the breast spontaneously only to go off to sleep or to remain calm in between feeds, which is about roughly 1.5 to 2 hours, and then comes and latches on spontaneously. Has 6 to 8 diapers, may or may not have several stools per day, but has adequate weight gain. For a term baby, you would roughly be happy if there is 20 to 30 grams per day. Mother feels that she has a full breast before feeding, and after feeding she feels that the breast is softer, so the milk has been received by the baby. So these are the markers of adequacy of breastfeeding. Now, having said that, let us now try and go to special situations and their solutions. So on the left side is breast engorgement. So what all can you appreciate in this breast? You would be able to see this picture. So what all can you appreciate in this breast? So there are some changes which are there, and I am waiting for you to answer on the chat box. So what all can you see in this breast? So is this breast normal? You would have seen mothers feeding the babies in 6th semester while going for ward postings. So is this breast normal? Yes or no? So is somebody awake? So can you tell me, okay, so this breast is not normal. Okay, so Ayushi says that yes, there is shiny skin. The breast beta is also swollen. This is not the normal breast. It is swollen. You can see shiny skin and you can appreciate the reddish blue hue. You can appreciate, this is normal, right? You can see the reddish blue hue. In addition to that, you would also see some prominent veins which are not there in this breast though. So you can see a shiny skin and you can see that this is all red. So what has been the cause? Probably mother has not been able to ensure frequent feeding. Mother is not wearing an undergarment which can support the breast, and the baby had improper attachment. So what is the treatment? The treatment is that you actually apply warm packs. You give the mother analgesics. Mother needs to express the milk frequently, and you need to tell the mother that please wear a tight fitting undergarment or a brassiere so that the breast is supported and there is no further engorgement. Yes. So let us now go on to the right side. This is sore nipple. So you can see that there is some redness here, and this soreness apparently happened because, and you can see some abrasions also. So this soreness happened because the mother was not able to position and attach the baby well, and this mother, its actual picture, she was actually washing her breast immediately after each feed. So before each feed, after each feed, she was actually washing the breast because she wanted to give the baby as clean milk as possible. So she was actually devoiding her skin of the basic oils. So improper positioning, improper attachment. I should have kept local candidiasis below this. The reason is that fungal infection is not a common cause of sore nipple. The most common cause is improper attachment and positioning and frequent washing of nipples. So if there is happening, so do not tell her not to wash, ensure proper attachment, apply hind milk and correct the underlying reason. Very rarely you may require to institute some antifungal. So in 1 in 2,000 mothers would require an antifungal, the others would actually resolve only with hind milk. So this is an inverted nipple. The same mother who developed sore nipple, this mother had an inverted nipple to start with. So the first step is that this is a syringe. You cut this end with a blade. Take out the plunger and put the plunger on this side. So this end was rough and this end is now smooth. So the third step is you put the plunger onto the mother's nipple and try to pull the plunger towards yourself. Yes. So when you pull the plunger towards yourself, you are actually creating negative pressure here and the nipple becomes protruding outside. So when you leave, when you have to take it off, don't take it off like this. No, it is not recommended. Leave the plunger, let some air enter and then gradually remove the plunger from the breast. So this is required at least 8 to 10 times before breastfeeding, each breastfeeding. So that means you end up doing it at least 100 times per day. So 8 times or 8 times breastfeeding per day with 10 times before each feeding, this actually would end up 80 to 100 times per day. So sometimes it could be a working mother. She should learn how to express milk. Before going to office, she can breastfeed the baby frequently, and she can empty her breast in the office, at work, so that she actually has a good milk supply. A few days before returning to work, express breast milk should be started and the baby should be trained how to feed with a cup or a spoon. She breastfeeds in the morning, breastfeeds just before leaving and again on return, and at 9 times, as many times as possible. If her office has a creche facility, she could breastfeed during the breaks. Express breast milk during work, when the mother is at work, can be stored at 6 hours in room temperature and 24 hours in the refrigerator. So even when the breastfeeding mother is on duty, the breast milk can be continued to be given to her newborn neonate. So initial few weeks you should actually feed the twins together. If the mother is having twins, so they breastfeed together. So you can have a football position in which you actually hold the babies like 2 footballs in front of the breast. You might need a lot of pillows. You can switch baby from one side to the other side. Night nursing is comfortable if the mother is lying down flat on her bed and both the babies are actually lying. So one baby is in between her arm and the breast, and the second baby is lying across her body and the feet are tucked. I'll just show you an example. So this is the way that the mother sitting up can feed. So this is football position. The hand is above the head. Similarly, the other twin can be positioned on the other side. So this is the mother who's actually sitting and feeding both the babies. So she had triplets. Don't go with the bottle here. And this is the other way, that so you can feed both the babies in football position, and this is another way. She's comfortable, but she's taken a lot of help from the pillows, and relatives initially required to support her to breastfeed. So this is how twins are breastfed. So we talked about engorgement, we talked about sore nipple, we talked about flat nipple and syringing, we talked about twins. So sometimes it may so happen that mother may say, "Mujhe to doodh hi nahi aa raha." Inadequate milk supply is there. So first ascertain whether it is perceived, meaning mother just has a subjective feeling, or it is actual problem in breast milk supply. Relieve mother's anxiety. Give her back massages. There is a special way which we shall learn in the bedside classes. Promote frequent feeding and complete emptying of the breast. So you may consider starting some galactogogues like domperidone or metoclopramide or some home-based remedies. There is no evidence that they actually promote breast milk production, but this is more like a placebo effect. So what you can do is find out whether it is perceived or real. Find out whether the mother is doing frequent breastfeeding. If not, ensure frequent breastfeeding and complete emptying of the breast. Ensure correct positioning and latching, and also ensure that the mother is given galactogogues if ascertained by the attending physician. Now some other problems. What do I do if the mother is HIV positive? I will promote breastfeeding. So if not otherwise, that the mother actually says, "No, I'm going to give formula feeding because there's a slight risk of transfer." For all other mothers, take an educated answer, but then the breastfeeding is the norm. B or C, continue breastfeeding, give the baby vaccine and immunoglobulin. Active tuberculosis, breastfeeding. If the mother is getting chemotherapy, after the chemotherapy is stopped, give the baby breastfeeding. CMV positive, baby has to be breastfed. So term babies have always to be breastfed. So baby's jaundice is not a contraindication. Mother's hepatitis B or C is not a contraindication. Mother who's smoking, mother who's an alcoholic, it's not a contraindication. Mother CMV positive, it's not a contraindication. So all these babies have to be breastfed. If the mother is on these drugs, so till the time that she's on these drugs, breastfeeding is contraindicated. So mother on radioisotopes, lithium, disulfiram, tamoxifen, diethylstilbestrol, drug abuse, chloramphenicol, breastfeeding is contraindicated. Now there are some myths and the facts for not following these myths. The myth is the initial yellow milk is to be discarded. No, not at all. Colostrum is essential and should be given as early as possible after birth. The second thing, give mothers a lot amount of ghee. No, ghee makes them fat and flabby. Give them a diet rich in protein and green leafy vegetables. Breastfeeding will cause loss of figure and will cause sagging of my breast. No, breastfeeding actually keeps you in shape. It actually helps you to lose weight. If mother is ill, don't breastfeed the baby. That is the myth. No. If the mother can breastfeed, she must do so. In fact, during these illnesses, breast milk protects the baby from the illnesses. If you increase the milk intake of the mother, she will yield more breast milk. So this is also not the answer. She is not a cow, right? So no, however, what you want to ensure is ensure good hydration. So she should take milk as much as she can, no issues, but ensure that she has good hydration. Obviously, logically, she is losing a lot of fluid, she is giving the baby a lot of milk, so her overall nutrition is important. My breasts are of small size, so I cannot produce adequate quantity of breast milk. See, size of the breast is related to the fat, whereas milk gland depends upon the lactiferous glands which are there. So then all mothers are capable of producing enough milk also for their twins, irrespective of anything. So I could not breastfeed my first child, so the second child I will also again not be able to breastfeed. So these are myths. She can successfully breastfeed her second child if she wishes so. So I am coming to the end, and this is the 10 successful steps for breastfeeding which you should know. This is breastfeeding posters. So the first is, how do I ensure as a hospital in charge? First is hospital policy. Second, my staff has to be competent. Third, it has to start right at the time that the mother comes for antenatal care. It has to start immediately after birth and continue thereafter. Support the mother while she's here. Give the mother good amount of nutrition and supplements. Promote that the baby and the mother are together, rooming in, bedding in. It should be cue responsive feeding. No advertisement of pacifiers, supports, teats or bottles. And finally, support the mother at the time of discharge. Rope in the family and gather proper support. Having said that, breastfeeding and breast milk is the best nutrition. One should continue exclusive breastfeeding for 6 months, and 2 years or beyond it can be continued. Optimize positioning and latching. Understand and boost prolactin, oxytocin and rooting reflexes. Remember that the journey is not always smooth, but there are solutions which exist for all these problems. Having said that, let us come to the first question. So the first question asked by a mother is, my baby does not take feed. My baby does not suck. And when I deep delve, this baby is born to at term to a primigravida mother. But mother is always complaining starting from birth, "Bacha doodh hi nahi pita, doodh hi nahi pita." So what do I advise her? So 2 or 3 bullet points, what should be my advice as a bedside healthcare professional. So my baby does not take feed or does not suck. So what is my advice? So I am waiting for your answers now. So my baby does not take feed. So I am waiting for more answers. One answer has come. Mother simply says कि मेरा बच्चा दूध ही नहीं पीता है, मैं क्या करूं बताओ? Okay, so I would check for proper positioning and attachment. I would stop all prelactal feeds. Wonderful. So Amisha, this point is well taken. So it might so happen कि बच्चा ब्रेस्ट क्यों लेगा अगर बच्चे को ऑलरेडी कुछ टॉप फीड दे दिया गया है, कुछ फॉर्मूला फीड दे दिया गया है, या बच्चे ने ऑलरेडी कुछ शहद या हनी ले लिया, ग्राइप वाटर ले लिया. Your baby would not latch on to the breast. Why would the baby latch on to the breast? Fine. So my baby is not taking feed. So Unless the baby is small or sick, there is no reason why the baby would not take feed. Yes? So maybe baby has already taken feeds. Maybe the baby is sleeping. So if the baby is normal and is feeding on demand, maybe it's even interval of 4 hours, do not worry. Mother should not worry, and you should explain proper positioning and attachment. So I'm happy, Amisha and Ayushi, you could actually answer 2 out of 3 bullets which I had listed as answers to a mother who was saying my baby is not feeding. Now second question for you 5. So my baby is crying all the time. I feel that the baby is not satisfied. So what do I do? My baby is crying all the time and I feel my baby is not satisfied. Yes. So answers. My baby cries all the time and I feel my baby is not satisfied. Okay. So maybe the baby was not able to. Great, Ayushi. So you clicked. So baby is crying, but if the baby's weight is okay, mother might just be over apprehensive that the baby is crying just like that. Point well taken. I would check for illness. I would see whether the baby is crying after urination or the baby is wet or there is some other reason. So check for other reasons. It is not important. See, बच्चा रोएगा ना, पर ये तो नहीं कि जब हमेशा बच्चा रोएगा बच्चे को भूख ही लगी है. It's something that baby cannot express. The baby can express only by crying. Check for wet nappy, check for wet diaper. It might so happen baby might be warm, baby might be having fever. There might be other reasons. So explain that the baby may have different causes of crying. Excessive clothing, underclothing, passing urine. It might not be hunger. Tell mother that her milk output is gradually going to improve over next 2 to 3 days. So this is something which is the take home from this slide. This baby might be crying because baby is not getting that much milk that the baby wants, but that is fine. Baby can sustain on the colostrum even though the volume is less. So do not tell the mother कि अगर दूध दिख नहीं रहा है आते हुए तो आपका दूध कम है, आप supplement शुरू करो. No. So ensure correct technique. Ensure that there is no flat nipple or engorged breast. So first come first, there are different reasons why the baby cries. Tell the mother, reassure her कि बच्चे को कुछ नहीं होगा, 2 से 3 दिन में आपका मिल्क आउटपुट इम्प्रूव कर जाएगा और आपका एनर्जी डेंस कोलोस्ट्रम इज गुड इनफ टू सस्टेन द बेबी. ठीक बात. देन एंश्योर प्रॉपर पोजिशनिंग एंड प्रॉपर अटैचमेंट. अमीशा बेटा यूटीआई नहीं होता है बच्चों में. न्यूबॉर्न बेबीज हु आर एक्सक्लूसिवली ब्रेस्ट फेड, व्हाई वुड दे डेवलप यूटीआई अनलेस एंड अंटिल देयर इज एन अंडरलाइंग malformation? No, they don't develop. So the way you will answer this question if the baby is crying, there are multiple reasons. Number 1, energy desk colostrum is good enough. Baby does not need supplement even after crying. Number 2, and third, you ensure proper positioning and attachment. Is my point clear? Yes? Yes. So mother comes, she says, ठीक है आपने बोल दिया मतलब कि 2-3 दिन में improve हो जाएगा. Can I eat something which can improve my breast milk production? So tell me what to eat. Doctor, you tell me what to eat. I will eat whatever you tell me, but I want my breast milk production to increase. So what do you tell? What do you tell her? What do you tell her? So is there something which can increase the breast milk production? Yes? I have 5 of you looking. So is there something which can increase the breast milk production? So I'll take 2 more minutes. There is good. So Ayushi has given. So it's a normal diet, lots of fluid. Relax the mother, allay her worry, stress, doubt. So Ayushi, the answer should have been galactogogues have no evidence, but most important stimulus is frequent suckling. Allay her anxiety. She should take a normal diet without any restrictions. So the answer is not this. The answer is the first 4 bullets. Normal diet without any restrictions, lots and lots of fluids, suckling of the baby, slight back massage and relaxed attitude. Galactogogues have no evidence to support them. Doctor, I am tired. एक रात को एक फीड दे दें, सिर्फ एक टॉप फीड प्लीज, बिकॉज आई नीड टू कैच अप स्लीप. I have not slept for one day and I'm so tired and I'm bleeding and I'm having pain. Can I give just one top feed? The answer is no, no, no. Anything other than breastfeed should not be given. In addition that there is no need, also remember that it can cause infection. It can cause subsequent problem in breastfeeding because कभी बॉटल को उल्टा करके देखना फीडिंग बॉटल को, बेटा वहाँ से मिल्क ड्रिप करता है ना. अब अगर आप ब्रेस्ट फीड देंगे तो बेबी हैज़ टू एक्टिवली नर्स ऑन द ब्रेस्ट. If you are giving bottle and the milk is dripping, baby would obviously think it's an easy way out. Why should I suckle on the breast? So in addition to problems with infection, it can also cause direct breastfeeding confusion. In addition to that, night feeds are important to sustain breast milk production. So they are to be given. How frequently should I feed? On feeding cues, generally if the baby is sick, too early, otherwise on demand. Don't worry, clinical check for adequacy of breastfeeding and that's it, right? That is the only thing which is the take home from here. So you need not do anything else except these slides for the purpose of your exit exam, that is your final exam in 9th semester. B, for your MCQs also, if there is a question in MD entrance, it will be directly from this. There will be no other questions beyond this. So no extra reading is required. But what is important is you can actually see few videos. So on YouTube, click preterm baby package playlist. Click on good nutrition. You have all the videos, including those which were shared by Dr. Ramesh. So expression of breast milk, palliative feeding, orogastric feeding, positioning, attachment. There are some 9 or 10 videos on good nutrition, free to download, free to access. So you can see them at leisure whenever you are free. That's it. So if there are some questions, I'll be happy to take them, or if you want, then let me know in case something has to be repeated. Yes, so we understood all this. So let me know if something needs to be repeated. Yes, so we have good 4 minutes before we close. I have just 5 of you listening to me. Hopefully the others would see the recorded session later. So any questions, let me know. So we will be having bedside sessions in which we show you videos and we have live examples and any other queries. So this is 13%, just to revise. So the magic figure of 2, yes. So your breast crawl, adequate positioning, adequate attachment, reflexes, worry, stress, pain, doubt as inhibitors of oxytocin. Adequacy is important. You should know the definition of breastfeeding adequacy and then breastfeeding problems. So hopefully things should be clear, right? So this is the summary. So journey of breastfeeding is not always smooth, but solutions do exist and they should be always sought to for, right? So thank you so much and we close for the day.